Yes, with what criteria we will, yes, this is chronic inflammation. So we read about acute inflammation, right? So on what basis we divide acute and chronic? What is the basis of dividing anything into acute and chronic? Yes, duration, that's all. Not the type, nothing, it is duration, time. If it is less than, it is a short period of time, it is acute. If it is going to be chronic, it is always, it is long time. Okay, so that is the difference. But here in inflammation, there are some other characteristic also. So in acute, there is a type of cells which is produce a type of reaction. In chronic, there is a different type of reaction. The presentation, clinical presentation varies. So acute is always short duration. Anything. Okay, for anything acute, in general, it is called short duration. Chronic, it is always longer duration. Okay, this is the basic difference. Apart from it, we have pathological and clinical symptoms, different clinical symptoms. So today in chronic inflammation, I'll just tell the concepts. You all already read the concepts, and I will just go and see what is a chronic hepatitis and chronic pulpitis. Both are one is systemic example, one is a dental example. Okay. So see, the principle number one directly says that any chronic inflammation is of prolonged duration. It can be weeks, months, or 2 years. Okay, sometimes the chronic inflammation can be for weeks. Yeah, a staphylococcal infection. Okay, or it can go for a month, gonorrhea, gonococcal infection or syphilis, and for years tuberculosis. Okay, and HIV. It can be either viral or it can be bacterial also. That causes is immaterial. Okay, so the duration of the inflammation is much more important in classifying acute or chronic. Okay, and the next important thing, any acute inflammation, it is going to be, we are talking about inflammation, it is a pathology. So with the pathologically, what we will see classically, we will see mononuclear cells. Okay, what are the types of cells we have in our blood? Is RBC, WBC. Okay, what are the types of WBC we have? What is the difference between all neutrophils and the lymphocytes? Basic difference. Yes, if you see multiple, last session I told, if you see a neutrophil, a multinucleated cell. Okay, if you see a multinucleated cell, it is acute. Okay, in chronic inflammation, you will see mononuclear cells. What are the mononuclear cells we have? Yes, a lymphocyte and monocyte. Yes, so neutrophil always acute. Lymphocyte always, if you see lymphocyte, always it is not lymphocyte. It is lymphocyte and the mononuclear cells. If you see monocyte also. Okay, sometimes, okay, it according to the infection we may classify, but in general, if it is acute inflammation, we see neutrophils. In chronic inflammation, we see mononuclear cells, not only lymphocytes. It is mononuclear cells. Okay, when we classify according to the type of infection, what is infection? Is bacterial viral. Yes, if you're classifying according to the infection, most of the time bacteria it is what? No, it can be acute. I'm not talking about the type of inflammation, type of infection. I'm talking about infection. Yes, neutrophilia. Bacterial, it is always neutrophils. If it is viral, it's neutrophils. It is viral, it is lymphocytes. Okay, again that is immunology. This is how our body defends. For bacteria, the lymphocytes doesn't come in. usually it will be, yes, nothing is coming. What's the number? You getting it now? Check your system. Getting it? You're not getting it? You have a link window? You have a link window? Oh, she got it. What's number 33? Okay, you just adjust. We'll not stop it now. Okay, you take, yes, you see that one. Okay, so in acute inflammation, we'll have a multinucleated cell, and in chronic inflammation, it will be mononuclear cells. Okay, so if it depends. Okay, so if it is an infection, even it is acute viral infection, we'll get lymphocytes only, because it is body defense according to the type of pathogen. If it is bacteria, the neutrophils are the first one to defend. So if it is going to be viral, the neutrophils have no role in it. So what will happen? The lymphocytes has a capacity to defend against viral infection. So if it is infection, we'll have a lymphocytes also, acute inflammation. But generally, when we are talking, it is acute inflammation, it is neutrophil, and chronic inflammation, it is a mononuclear cells. It can be macrophage, it can be plasma cell, and it can be lymphocyte. What is a plasma cell? Yes, it's lymphocytes, activated lymphocytes. Okay, it is activated lymphocytes. Plasma cell, B cells. Okay, it's activated. It becomes plasma cells. What is the function of plasma cell? Is to produce antibody. Okay, so this is how the lymphocyte, the B cell get activated and become plasma cell, and they produce antibody. Okay, the function of the antibody we'll discuss later when the time comes. Okay, so this is a principle, and coming to the direct systemic example. Okay, it is called chronic viral hepatitis. Okay, so what are the things? Explain the terms chronic. What is chronic means? Chronic means is longer period. Viral, it is viral infection. What is hepatitis? Is the inflammation in liver. So it is a inflammation in the liver due to a viral cause, and it is of longer duration. Okay, this is how we put it. If we put in English, the chronic viral hepatitis will be translated. Inflammation of the liver, the cause of it is viral, and it is of longer duration. Okay, that is what chronic viral hepatitis. So what we see in a chronic infection, again, what we will see in a chronic inflammation? What is a classical thing? Immediately what we will see, if it is a chronic inflammation, what are the things you have to come immediately to your mind? One is a longer duration, next one is the mononuclear cell. That's all. Okay. So apart from it, if you remember your lectures, apart from it, any inflammation, okay, it will end in what? Yes, always there is a cell death. Okay, so always there is a cell death. Okay, one. Okay, necrosis. Okay, not never apoptosis. And after the necrosis, what it will be? No, necrosis is one death, one type of it. There is never apoptosis in inflammation. Yes, that is scarring. It is going to become fibrosed. Okay, it is going to be fibrosis. Okay, sometimes the cells which have regenerating capacity, okay, it regenerates. But if the cell is not having any regenerative capacity, it is going to, yes, just a fibrous deposit, and it is going to even the fibrous deposit is going to be there and forms the fibrosis. But we have a condition here, chronic viral hepatitis. Okay, the hepatocytes of all the tissues in our body, it has a very good regenerative capacity. If you just cut off of a liver, okay, or quarter of just part of a liver, if you take resect it, and within 1 year it will again grow back. The hepatocytes, the liver has a capacity to regenerate. But here what is seeing, okay, here what you are seeing, we finished this, actually this picture. It's a picture of liver. Okay, the hepatocytes will be like this. Okay, the normal histology of liver, it will be like this. It's hepatocyte, and again it's a polygonal. It's hepatocyte. Okay, and you have the artery, vein. Okay, it is called the portal tract and lymphatic. So these three, you have a artery, a vein, and the lymphocyte. It's called portal tract. Okay, just for your, I'm not taking any histology here, just for your orientation. So it is just like this, a normal hepatocyte, the portal tract. Okay, so what we see here in the picture, what we are seeing like this. We have see a vacuole. Again we are seeing one and big vacuole here. So it is like this we are seeing, right? What is this? We have finished that. It's not acute anything. See here. This is one cell. This one cell. Again this is one cell. What is this? This one. What vacuoles? Fat. So when we are seeing fat, it is always something chronic is happening there. When we see fat in the hepatocytes, it is always something chronic is going on. Okay, so this is a fatty liver. Fatty liver is a subcellular alteration. Already the last session we have discussed about fatty liver, right? Alcoholic usually go for the fatty liver. Okay, here it is again a viral infection. Okay, infection. What is more important is this area. Okay, this area. What do you see here? Yes, the aggregation of a mononuclear cells. Okay, now it is you have to tell it is a mononuclear cell. Whether it is a lymphocyte or this, we will say later. Okay, so there is aggregation of the mononuclear cells. The mononuclear cells usually in viral infection it is going to be lymphocyte, and it is a chronic viral infection. It is going to be lymphocyte. Okay, so you see a mononuclear cell infiltrate, and above all, okay, mononuclear cell, and above all, a classical feature of a chronic inflammation, the fibrosis. This is the normal lymphocyte, I mean hepatocyte. Although it is not normal, the fat is there. It is maintaining the structure. Can you see? It is like this. Yes, this is maintaining the structure. But here you see, it has been replaced by the fibrous tissue, and you see mononuclear aggregates. Okay, This is the injury caused by what? It is injury caused by, what is the cause of the injury here? Yes, it is viral, because of the viral. Okay, most of the time it is HCV. What is HCV? What is HCV? What is HCV means? What is HBV? Now it is bacterial. Yes, yes, it is hepatitis B, and HCV is hepatitis C. That's all. HCV is hepatitis C. Okay, HCV. HBV is hepatitis B. Okay, that is what you will usually see here, HBV. Okay, HCV. This is HCV infection. Okay, the most commonest finding in any viral infection is the mononuclear or lymphocyte aggregates. Okay, when there is inflammation, there is always inflammation is followed by necrosis, and the cell able to regenerate, it will regenerate. Otherwise, it will lead to fibrosis. That's what you are seeing here. Okay, the mononuclear cell infiltrate and the fibrosis. Okay, this, if you see fibrosis, it is surely there is a liver damage. In liver, you will not see any fibrosis, any other tissue. If you see fat, again it's abnormal. If you see lymphocyte, it's again abnormal. If you see fibrosis, again abnormal. Okay, you have to see only the hepatocytes in liver. And what you will see, the portal tract. The portal tract is the vein and the arteries. The portal vein and the arteries, hepatic arteries. Okay, that is called the portal tract. So apart from this, if you see anything, it is abnormal. So in chronic viral hepatitis, usually you will see fibrosis. Okay, it is called bridging fibrosis, because you see in your picture, you see one portal tract is here. Okay, and another portal tract is here. In between these two portal tracts, there will be fibrosis. Okay, this is called bridging fibrosis. It bridges the two portal tracts. Okay, that's what is happening here. See here, one portal tract is here. You are seeing this is a blood vessel, and again you are seeing some blood vessels here, right? You see the fibrosis here. It is bridging. It is bridging between these two. Again, it is bridging here. Here you see some portal tract here. It's called bridging fibrosis. It's a classical feature of the chronic viral hepatitis is the bridging fibrosis, mononuclear cell or lymphocyte aggregates, and apart from it, you will see in any chronic inflammation, okay, you will see some fatty changes. Okay, fatty changes, as such, it is a normal, a separate separate standard. Your ILO, one ILO has been dedicated to fatty changes. Okay, it is a separate learning issue, but it is overlapping here also. Okay, so it is application again. Okay, so this is a chronic viral hepatitis. Okay, this is a systemic example which we have selected for your dental program. So we go for a little bit familiar grounds. Okay, we'll discuss a case here. A 26-year-old female came to dental OP. Her chief complaint is that she noticed some growth over her teeth. Okay, her oral examination revealed pink color growth over the teeth. The dentist removed and sent for histopathological examination. Okay, so she noticed some pink color tissue here, the growth. Okay, so and he consultant. What is that? What do you think it is? Pink color pus. Pus is what? Pus is neutrophil and necrotic debris. Okay, the pus is neutrophil and necrotic debris. Pink color growth. Okay, we'll see that. So for caries, okay, the last session, if you remember, Okay, it is like this. You have the pulp here, right? So what is caries? What is caries? Dental caries? This is a bacterial infection. Okay. So when we call it a pulp, here it's a pulp. Okay, it's going. Okay. Okay. So when we call it as caries, when we call it as caries, yes, it is only in the enamel we tell it as caries. Okay, once it reaches the pulp, what we tell? Yes, it is pulpitis. It is if it is acute. If it is acute, okay. So we are talking about acute. It is we then tell it is acute pulpitis. Okay. So if the same condition becomes a longer duration, see the acute is only within days. So if the same infection, okay, the caries, it is prolonging for a longer duration, more than a month, we tell it is chronic. Yes, we tell it is chronic pulpitis, but something will happen there. That's what we are going to discuss. Okay. Pulpitis. Which one? You tell me. Yes, there is always two inflammation. One is acute and chronic. Everywhere. Everywhere, not only the teeth. It can come in your eye, it can come in the brain, it can come in your stomach, it can come anywhere. Always when we talk about inflammation and an infection, yes, wait, it can be acute. Okay, all the infection or inflammation start at acute stage because it has to start somewhere, right? So if it is starting within it is becoming all right within 1 or 2 days, we tell it is acute inflammation and is responded to treatment. If it not responding and we are not treating, it is going to prolong. So it is going to become chronic. It depends. It depends. Yes, it is not in enamel, it is acute. It is in shorter duration. If you see, it is initial infection, we tell it is acute. If it is prolonging more than a week, it is going to be always chronic. All the things, not only caries. So usually when we see caries, it is going to be in the chronic duration only. Yes. Chronic. Most of the time, yes. It was the injury must have started acute, and the presentation is always chronic. It is on if anything goes beyond 2 or 3 days, we tell it is chronic. Okay, if it goes for a week, we tell chronic. Okay, if it is prolonging more than for a week, we tell it is chronic. Okay, and again if it is coming again the second time also, we tell it is chronic. Second time again, if it is we are treating some condition, we are treating. Okay, pharyngitis, yes, again it is a chronic condition again. Okay, second time, that is different. Okay, don't worry about that. But if it is prolonging for more than a week, we tell it is chronic. Okay. So what we see here, it is an inflammatory response. Okay, the inflammatory, the pink color tissue, what you see. So this when it is going to the pulp, it is called acute pulpitis when it is shorter duration. If it is a longer duration, what it is going to do, it is going to destroy this enamel. Okay, destroy this enamel here. And here in pulp, we have a very good blood supply, everything. So when there is infection, okay, the blood supply, what it will have? It have a neutrophils, all the things which is needed for the defense system. So if it has a good blood supply, what it will do? It will fight the infection there. Okay, so when it is fighting the infection, okay, it forms a new tissue there. Okay, whenever you see some pink, okay, whenever you see a pink color in your surgical practice, pink color, okay, not whitish, it's like pink color, okay, it is always good. Okay, what is happening there? What is that? What does this means? What does this means? Granulation tissue. Does it mean anything to you? No, does it mean anything or doesn't mean anything? Do you understand this term or not? That's all. Yes or no? Yes or no? No, that is no is the answer. You don't know about what is granulation tissue. Okay. So granulation tissue is nothing but a new tissue formation. Okay, if there is an injury, okay, we talked about injury. So if there is a new tissue formation, okay, there we will have blood vessel. Okay, we have blood vessel here, and there will be lots of blood vessel and lots of fibrous tissue. So for any new blood vessel, there has to be lots of fibroblasts and this fibroblast and blood vessel. So this is called granulation tissue. It will be usually pink in color, pink. So for any surgeon, if he is going to clean the wound, if he is seeing pink color tissue and blood is coming from that, it is good. It is good for him because the wound is healing. Okay, if it is completely covered with white material, okay, he is not able to clean it, then and it is becoming little bit yellow or some other color, it is always bad because of the infection. It is infected, the bacteria forming the pus. Okay, so pink color, it is here. She noticed a pink color, right? In the previous slide, she noticed a pink color tissue growing. Okay, so what is that? Is that it is a chronic hyperplastic pulpitis. So what is important in that? It is covered by stratified squamous epithelium. Okay, what is stratified squamous epithelium? What is stratified squamous epithelium? What is stratified squamous epithelium? What tissue? What is a stratified squamous epithelium? Where we saw that? Where we see stratified squamous epithelium? Where? Yes, oral mucosa. That is your lining epithelium. You can never forget this word. Stratified squamous epithelium. Okay, it is oral mucosa. Okay, the teeth is again inside the oral cavity. The most common thing again it is going to become is stratified squamous epithelium. Okay, so once the chronic inflammation, it reaches the pulp. Okay, the infection reaches the pulp, it becomes chronic. The chronic inflammation is okay, it is fought back by the neutrophils. Okay, once it is fighting back, it is going to destroy the bacteria, but there is going to be some space left. So what will happen in that area? It will because of the native population, the stratified squamous epithelium, they come here and they try to heal. Okay, it is not the enamel, it is not going to regenerate, but the stratified squamous epithelium, okay, we have stem cells in the blood, so it is going to get deposited and it is going to heal. So that is what happening. The animal research is showing the same thing. Okay, the pulp infection, it is fought back by the neutrophils and which has a very good blood supply. The pulp which has a very good blood supply, it will fight back the infection and forms the granulation tissue. Okay, granulation tissue is nothing but the healing process. Okay, that is what the patient noticed. A pink color tissue growing in the caries. Previously she must have had caries there, and she immediately noticed some pink color. After some time she noticed a pink color growth. The pink color growth is nothing but the keratinocyte, the stratified squamous epithelium with the granulation tissue. Okay, so acute pulpitis. So how you differentiate between acute pulpitis and chronic hyperplastic pulpitis? What are the points you will see? The basic points you tell. Afterwards I will tell the technical points. What is the basic point? Acute pulpitis and chronic pulpitis. One is short duration. First is a short duration. Acute, it is short duration, short time. It is a longer time. Okay. And here you will see only the infection and the inflammation will be acute, and you will see some necrosis. Right? Here you will not see the necrosis, but you will see granulation tissue. Okay, it is regenerating. The tissue is healing. Here, if you see granulation tissue, it is healing. Okay, that is the most important one. You see short duration, acute pulpitis, long duration, chronic pulpitis. You see inflammation and necrosis in acute pulpitis. You'll feel pain also. Okay, you will feel pain also. But here, usually there will be no pain, and you will see granulation tissue. If you see granulation tissue and keratinized squamous epithelium, it is always hyperplastic chronic pulpitis, a chronic hyperplastic pulpitis. Okay, this is a basic difference. You understood this? Chronic hyperplastic. What is hyperplasia? What is hyperplasia? What is hyperplasia? Increase in the decrease, increase. Yes, increase in the number of cells. Increase, hyper. Here hyperplasia. Hypoplasia has never come. This term, you know, hypoplasia. You come across hypoplasia. Hypoplasia you have heard. Then what is the use? No, if you have, see in MCQs also. Yes, in MCQs also we will give the choices. What are the things you know? Yes. So what are the things you don't know? It is easy for you. So what are the things you know only? It is difficult for you. So in MCQs, what if you read carefully, the options will be, the distraction will be, what are the things you will know? And it will somewhere there is some relation, but only one good answer. Okay, we are training you for good for that. Okay, actually it is very good for you. Okay, and we have the questions also. It is all standard questions. For your future, it is very good. If you are trained in this, you can go for any competitive exams with ease. At least if you are trained for that, you will be able to accommodate there. Okay, so the distractors, if you see carefully, all the things we know only. So we don't go out of what you don't know. So hypoplasia, we have not told. We have told in previous labs, previous batches. We have told we have included hypoplasia, but we have removed it. Hyperplastic, yes, yes, chronic hyperplastic, because there is increase in number of some keratinocyte. It is there. Okay, and it is pulpitis. So what are the things which is coming to your mind here? Chronic hyperplastic pulpitis. You explain to me in English. So how you tell it is in English? Chronic hyperplastic pulpitis. Increase in, it is inflammation of pulp for longer duration. Okay, and increase in number of keratinocytes. So this is a meaning for this chronic hyperplastic pulpitis. It is inflammation of pulp for longer duration and increase in number of the keratinocytes. Hyperplastic, increase in number. What is hyperplastic? Keratinocytes. Pulpitis, inflammation of the pulp, chronic longer duration. Okay, if you see these three words, Okay, this has to come to your mind. Okay, so this word, if it is there, what you will see? Acute pulpitis. Yeah, it is good thing or not, it is different. It is pathological, but here it is a good thing. Here it is a good thing because it is involving it is destroying the infection and forming a layer of them. It is covering the infection. So here it is a good thing. Usually hyperplasia is not a good thing. Okay. Here it is fighting the infection. Yes, we don't know. Nobody. Nobody will know it is a good or bad. It is always bad for us. Whichever thing it is coming to pathology, it is always bad. Okay, but here it is not good. I'll not tell it is good. For some extent, because you see this is a teeth. See, this is a teeth. Teeth has to be, enamel has to be here. Okay, enamel has to be here, but you are not seeing the enamel. You are seeing a chronic hyperplastic pulpitis. So it is not good naturally. So it is bad. But instead of what it is there, instead of what it is there, previously what it is there, the enamel was there. After that thing, what was there here? It yes, yes, it is healing. Yes, it is trying to heal because previous to this there was infection. Infection is always bad, right? Infection is always bad. So because instead of infection, at least we have something which is native to that oral cavity. So that in that way it is good. I'm not telling hyperplasia is good. See, in this instant, because of instead of infection, which is bad bacteria, this hyperplastic keratinocytes are there. So that is good actually here. You understand the concept here? Yes. Yes, it is. It is not. The infection is not there. It is there. It is good. Yes. Okay. This we will correct it later. This you draw it in your home and we'll go for the next session. Okay. This is so chronic inflammation. What are the things you'll see in chronic inflammation? One, long duration. Yes, and mononuclear cell infection. Mononuclear cells. Okay. Yes, Lina, I'm going to send you out. Okay. This is we'll finish the next session and we'll go for the formative. Okay. Now we'll finish the formative. You don't have a power out? It's not given to you? No, wait, wait. No, don't worry. Is it? Yes, power out is needed, but it's not working here. It's not working. Okay, we'll just discuss the case. Okay, a 25-year-old male came with severe cough for past 2 days. On examination, it showed inflammation of the pharynx. Okay. Investigation shows increased lymphocytes and raised ESR. It is erythrocyte sedimentation rate. It is not pathology, it is physiology. What you're seeing that there? It just we'll discuss because we are not giving the power vote. Okay, we don't have time. Okay. So ESR is erythrocyte sedimentation rate. It is a clinical example, clinical condition of or lab investigation of the inflammation. If there is inflammation, the erythrocytes are going to get deposited or sediment. Okay, the rate of that sedimentation we will calculate. So if it is increased, it is due to some inflammation. It is non-specific, but nevertheless it is good for the indicator of inflammation. Okay, so here a 25-year-old male came with severe cough for past 2 days. Okay, what are the things you have to see? One, forward is working. No, it is not working. Okay. So what are the things you have to see? Severe cough is C, clinical complaint, and the duration. Okay. On examination, it showed inflammation of the pharynx. Okay. So investigation shows there's increased lymphocytes. Again, it's increased lymphocytes. Okay. What are the things you tell me now? What are the things you'll see? Yes. One. Why you are telling it's chronic inflammation? 2 days and lymphocyte is chronic inflammation. So what do you think it is? Yes, mostly active viral. Okay, why? It is not chronic inflammation. Why? Yes, it is in two days only. The presentation is 2 days. Okay, it is not a chronic inflammation. So that thing is very important here. The duration. Again, it is increased lymphocyte. When I told about chronic inflammation, okay, all mononuclear cells are it's chronic chronic inflammation. But I also told some other point. What is it? If it is a viral infection, it is going to be lymphocyte again. Whether it is acute or chronic, it is always going to be lymphocyte because the neutrophils cannot defend against the virus. It has no defense mechanism to fight the virus. Only the lymphocyte has. The lymphocyte, yes, it can fight back. Okay, why? How it is fighting back? It is producing the plasma cells and producing the antibody. Then only it can produce. It can defend against virus. The lymphocytes, okay, it will produce the plasma cells. Once there is a virus, okay, once there is a virus inside the body, okay, once there is a virus in the body, the lymphocytes, okay, it will recognize the virus and they convert into a plasma cell, okay, plasma cell. This is B cell. Okay, B cell recognize it and they'll produce IgA or IgM or IgG antibodies. Okay, they produce antibodies and these antibodies will fight against this virus. The neutrophils has no effect on the virus. That's why if there is a viral infection, it is always lymphocytes will be there. Okay, so here it is 2 days and there is a lymphocytes and pharyngitis. So it is the most probable this thing will be acute viral induced inflammation. Okay, we'll see the answer. Yes. Okay, it is acute viral infection. Okay, active viral induced inflammation. Okay, that is what there is a cause of ESR rise. Here we are not talking about what is the cause of the infection. We are talking what we are asking what could be the reason for the increase in ESR. Again, I told it is ESR. If it is increased, it is non-specific. ESR is non-specific. It can be raised for any reason. It can be raised for viral, it can be raised for bacterial, or it can be fungal also. So we cannot find out what is the reason for that ESR raise. It is, but we can find out whether there is inflammation or not. So it is indicator for inflammation, not which type of infection. Why? Because there is no, only the lymphocytes are increased, the neutrophils are not increased. In bacterial, it is always neutrophils will be increased. Okay, here we see the next case. A 40-year-old male has joint pain for a few years. Okay, at present, pain is severe. On examination, it shows restriction of movements and severe tenderness. Okay, there is a restriction of a 40-year male, joint pain for a few years. What do you? It is a chronic condition. Yes, it is a very, very chronic condition for few years. Okay, not for few days. Okay, now the pain is severe. On examination, clinical examination, there is a restriction of movement. You cannot move the legs and joint. Okay, there is a restriction because of the pain. He is not moving. Okay, movements and severe tenderness. What is tenderness? Tenderness. Tenderness means what? What is pain? What is the pain between, difference between pain and tender? It's all clinical. Pain. When we tell tender, it is very soft always. The typical term for the meaning of tenderness, you are very tender, you are very soft. That is not the case here. What is the difference between pain and tenderness? Pain is a pain which is already present. We need not elicit anything. Okay, if you have a headache or leg pain, you will tell it's pain. Okay, the tenderness is just different. If you just press it, palpate it, then only you will have pain. You understand this? The pain will be normally present. You will not elicit anything. You will not touch it. You will not do anything. The pain will be there. That is called pain. Okay, usually the person will be normal. If you touch that area, it will produce pain. That is called tenderness. Okay, you understand the difference? That is called tenderness. So usually a patient with the knee, here we will talk about the knee. So there will be no pain. If you touch the area, knee, it will produce tenderness. Usually the children will do that. Okay, normally there will be no pain. If any wounded area, if you touch it, it will produce pain. Okay, that is called tenderness. Okay, investigation shows there is a C-reactive protein and leukocytosis. What is your interpretation? A C-reactive protein again. Okay, the C-reactive protein again, it is a indicator for inflammation. Okay, and leukocytosis. Leukocytosis is what? Increased white blood cells, that's all. Okay, so what is this? What is the case? No, tuberculosis, it will not have this clinical condition. Yes, a few years. Usually tuberculosis will not be there for a few years. It will be treated. Yes, mostly it is not. What are the things you can exclude here? It is acute. Yes, it can be chronic one. Okay, and it can be tuberculosis. We are not given anything about tuberculosis here. Okay, we have not any clinical. Yes, it is. If all are there. We are talking in general. In general, it is lymphocytes, neutrophils, everything is, all the WBCs are increased. So that is inflammation. Some inflammation is there. Okay, we cannot tell it is what type of leukocytosis. We are not told what type of leukocytosis, whether it is lymphocytosis or neutrophilia or basophilia something. But it is few years, so it has to be a chronic. Okay, and severe pain in the joint. So what we tell is pain in the joint, or it is called arthritis. Arthritis. So it is chronic arthritis. Okay, the clinical, again, it is there is no clinical signs and symptoms regarding tuberculosis. There is no cough, low grade fever, everything will be there. We'll give. So in cases, we will not give something which is not there, and we'll ask the question. What is relevant only we'll ask the cases. Okay, if you are asking about tuberculosis, what are the classical features of tuberculosis, we'll ask. Classical features of tuberculosis we'll ask. After that only we'll ask tuberculosis. If you are just, it is joint pain, severe pain, loss of restriction, it is always, it leads to only one thing. It is arthritis. Okay, even it's arthritis, tubercular arthritis, will give some clue here in the cases. Okay, so it is chronic, few years, chronic arthritis. That is what we need here. Whether you are able to differentiate between acute and chronic, that's all. We don't want you to know about arthritis now. Okay, because we cannot tell, it's a chronic case, we cannot give. So we have to give something related medically. That's why we give arthritis. Okay. Now only it is picking up. Now only it is picking up. Okay. So we'll go to the next. Yes, your next this thing, we'll just finish. It will be easy, very easy for you. You will understand. If you understand what is chronic inflammation, we'll discuss about the specific type of chronic inflammations here. Okay. So one is the morphological feature of tuberculosis and actinomycosis. Okay. So this is very important for you. Again, the same principles. So chronic inflammation, longer duration, and you will see mononuclear cell inflammation. Okay. The first picture we'll see is the tuberculosis. Okay. The gross feature, it's a picture of the lung. Okay, it's a picture of the lung. Okay. So this is a lung. Okay, it's a pulmonary tuberculosis. Okay, what we are seeing here is, this is a normal lung here. Normal, again it's a normal lung here. But particularly you are seeing something here. Okay, what it can be? Yes? Yes, fibrous. Yes, it can be fibrous tissue. Yes, one. What other things? Fat, okay. It is looking like a fat, yes. What are the things? It is an infection. I give you a clue, it is infection. I'm giving a clue, it is an infection. So what are the things? Yes? Tuberculosis infection. It's a tuberculosis infection. I'm giving you the clue. What it can be, this one. Fibrosis is, it's given already, the answer is given. What are the things? Fat, she has told fat. What are other things which can be present in infection? End of infection. Yes, it is a necrosis. Here these are all living tissue and this is a dead tissue, necrosis. It is not fibrosis yet. It is necrosis. Okay. Okay, what type of necrosis? What type of necrosis? What type of necrosis? What type of necrosis? It's already told. In necrosis, it is already told. The last session we discussed, right? Acute, types of necrosis. If it is going to be infarction, what type of necrosis will be there? You are asking me now, after 5 sessions, there are types of necrosis? No, it's not. It is not acute or chronic necrosis. Necrosis is only one necrosis. But we have different types. What are the types? Yes, 5 types are there. What are the types you know? If it is going to be infarction, blood supply loss, what type of necrosis? It is called coagulative necrosis. It is called coagulative necrosis. If it is going to be bacterial infection or infection, not bacterial infection, it is going to be what type of necrosis? It is liquefactive. So one particular type of necrosis comes in tuberculosis. What is that? Yes, it is called caseating necrosis or cheese-like necrosis. This is what you are seeing here, a cheese-like material. The normal tissue, lung tissue, again normal tissue, lung tissue. Okay, this is a cheese-like necrosis. If you see this type of lesion in the lung, okay, that lung is divided into lobes. Okay, this is one lobe and this is two lobe, three lobes. Okay, 1, 2 and 3. Okay, it is divided. So if you see in the upper lobe, this type of lesion, that is a necrosis, caseate necrosis, it is called Gong's focus. See here, it's called Gone focus or Gone complex. It is called primary tuberculosis. The initial infection of tuberculosis. What is tuberculosis first of all? What is tuberculosis? What is TB? What is the cause of TB? Yes, it's Mycobacterium tuberculosis. This infection is called tuberculosis. So if it is primary, the first time it is going to infect you, it is called primary tuberculosis. Okay. It is not treated, it is going to form a caseate necrosis, and this is called gone focus. This is called gone focus. GHON. Okay. So if it is not going to be treated, necrosis, what is going to be? Pus, and after that? Yes, fibrosis. So this is what happened here. So if it is not treated, okay, here one. Yes. See, this is a necrosis, right? If you see this is primary infection, it's called primary tuberculosis. If it is if this person is not treated, okay, if this person is not treated, this is a necrosis here. Okay, this is necrosis here. If it is not treated, what will happen? So this is necrosis here. The person is not treating. We are not treating him. Okay, there is necrosis here. This is necrosis here. So what will happen after the necrosis? A pus formation, everything is over, necrosis is there, dead, end of the stage. What will happen to the necrotic material? Fibrosis, yes, fibrosis. Before the fibrosis, this necrotic debris will be taken away by phagocytes. It is called phagocytosis. Necrotic debris will not be it will not prolong further. So it will be taken away. But this is a lung. Okay, the lung has no regenerative capacity. So what will happen? See, this is here. This necrosis here. Okay, it has been taken away by the phagocytosis. Okay, it is taken away. If you were taking away, what will happen there? There will be a cavity. So if something is there, you just scoop it out. See, ice cream is there. You are scooping it out. What will happen there? There will be a lacuna, right? The cavity. The same thing is happening here. There is necrosis, it is filling it. The necrotic material is taken away. Okay, it is taken away. So what will be there? There is a space there. That is called cavity in tuberculosis. Can you understand what I am telling? Yes, you have to listen to me. If you are talking and you are not listening, you will not understand. See, this is a lung, a cut section, okay, this section, okay. Here there is necrosis, okay, it's from sideways I am telling, necrosis is here, okay, a big necrosis, let it be like this, a tuberculosis, okay. So if you take away this area, it will form a hollow, right here. It form a cavity, right? That's what is happening there. That's what is happening. It is forming a cavity here. Okay, that if it is this necrosis, it is taken away by the phagocytosis, so it forms the cavity. If you see the cavity, it is always secondary tuberculosis. Okay, usually these are all classical features. See here, this area. Some cases necrosis is there. It is going to prolong. It is going to form like, if you take this area, it is going to form a cavity. These are all the classical features. Nowadays you will not see this because of the advent of the medications. In the primary, immediately in the acute stage itself, they will find out and they will treat it. Okay. So this is, if you see the cavity, it is secondary tuberculosis. Understand this? It forms cavitation. So this is, if you see the third picture, you see multiple white color things here. No. Still there is no fibrosis. See multiple colors, multiple white color lesions. Can you see this? Multiple lesions. If you see this multiple, this is all necrosis, caseated necrosis. It is called miliary, small millets, small grain-like. If you see multiple necrosis, scattered consolidations, it is called tertiary tuberculosis. Okay. So pulmonary tuberculosis, what is pulmonary tuberculosis? What is pulmonary tuberculosis? No, I'm asking what is pulmonary tuberculosis. Pulmonary tuberculosis is the mycobacterial tuberculosis infection of the lung. Okay. So this one, this area, this necrotic area, okay, this necrosis, caseating necrosis, only one area, it is called consolidation, Gons focus. Okay, it is called consolidation. It is becoming like solid. Solid, what, you know what is the meaning of solid, right? Yes. It is this one is this is called gong focus, or it is called complex or consolidation. Okay, it is called consolidation. Okay, the consolidation is removed, okay, by the phagocytosis, it forms a cavity. Okay, if you see consolidation only one area, it is primary tuberculosis. If you see a cavity in the tuberculosis in the lung, it is secondary. Okay, if you see multiple consolidation, the same, it's big, right? It is big here. If you see small, if you see small multiple, the entire lung, it is miliary tuberculosis or tertiary tuberculosis. Okay, understood this? So what is pulmonary tuberculosis? What is pulmonary tuberculosis? No, what is pulmonary tuberculosis? Yes, it is mycobacterial infection of the lung. If you see one consolidation, one area, large area, it is Gons focus, primary. If you see a cavity, it is secondary tuberculosis. If you see multiple consolidation, small consolidation, it is tertiary tuberculosis. Okay, that's all. That's all you have to remember. Okay. What? Yes, multiple small consolidation all over the body, all over the lung, it is tertiary tuberculosis or miliary tuberculosis. It is millet. Millet is small grains. You know what is a millet? Small grains. So you are seeing multiple grain-like structures. It's called miliary. Miliary. Millet seeds. Okay, that's all. That's all you have to understand. Okay, because how, where it is present, why it is present, this is all for medical. Okay, it is present in the lower part of the upper lobe. Okay, that where it is present is all medical. But what you have to know is how the gross picture is presenting, and what is tuberculosis, what is primary, secondary, and tertiary. That's all. That's a basic concept you have to know. If you understand this, you can. If you read this, what is this, you can just understand more. Yes. Which one? Tertiary is multiple consolidations. The consolidation we talk is because it is becoming more solid than the surrounding area. We tell it is solid. It is solidification. Consolidation. It's called consolidation. Okay. Yes. Than the surrounding area. This solid area is taken away. That's why it is forming cavity. It is called secondary tuberculosis. Okay. Yes. Coming to the histopathological feature. It's more important for you. Okay. You see, we are talking about caseating necrosis. Right? It's called granulomatous inflammation. You know what is a granuloma? It is already taken in theory, but it is I think it will be very fast. It was very fast in your theory. Okay, what is a granuloma? What is a granuloma? Wait, I'll write two terms here. Granulation tissue. Okay, what is granulation tissue? And you tell granuloma. Okay, is there any connection between these two terms? I want a yes or no, that's all. I want a yes or no. No. Okay, so that I'll take it as an answer, no. So what is granulation tissue? Tell me. Yes, that is new tissue formation. Yes, new tissue, a new blood vessel, new fibroblast. Okay, new tissue formation. What is granuloma? Yes, it is pathological. Okay, this is pathological. This is physiological granulation tissue, and granuloma is it is a reaction to a inflammation. Okay, to a chronic inflammation. Okay, mostly in tuberculosis. Okay, that's what you are going to see now. What is a granuloma? Okay, so don't confuse granulation tissue with granuloma. It is completely different. Okay, so that's what we are going to see. It is called granulomatous inflammation. If you see a granuloma in the inflammation, it is called granulomatous inflammation. Okay, what the classical example is? Classical example is? What is the classical example? Classical example is granulomatous inflammation is tuberculosis. Yes, tuberculosis infection is a classical example. If you forget anything also, it's no problem. Granulomatous inflammation is tuberculosis. That's all. Okay, so what is a granuloma? Yes, you told it is a reaction to the chronic inflammation. But how a granuloma will look like? Yes, I'll tell you. I'll draw a picture here. Yes, yes. See, this is how a granuloma will look like. Yes. Okay, I enlarged it here. Okay, what is this? It is a slipper type cell. It is a modified macrophage. It is called what? No. A macrophage, it is just like that. Okay, it is like this macrophage. Okay, it's a macrophage. You know what is a macrophage, right? Yeah. Okay. This because of the reaction, okay, because this due to the chronic reaction, it is converted like this. The shape of this is converted like a slipper shape. You know what is a slipper, right? Slipper. You know what is a slipper? What we wear, okay, what we wear in the legs. The slipper. So it is converted like this. Okay, this is called this now. It is no longer called a macrophage. We tell it is epithelioid. Okay, epithelioid cells. Whenever we are telling oid, what is the meaning of that? Oid, ovoid, epithelioid. It is like, okay, it is like oval. Oval is oval here. This oval. Okay, if you're telling like this, it is ovoid. This oval and this ovoid. It is like oval. So here what it is like epithelial cell. It is not epithelial cell, like epithelial. That's why it's called epithelioid cells. A collection of epithelioid cells is called granuloma. Okay, you understand the term granuloma? The collection of epithelioid cells is called granuloma. The granuloma can be, if you see a granuloma in the inflammation, it is called granulomatous inflammation. Okay, it is as simple as that. The collection of epithelioid cell is called granuloma. If you see granuloma in inflammation, it is called granulomatous inflammation. Okay, the granulomatous inflammation can be caseating or non-caseating. Okay, granuloma can be caseating or non-caseating. Here we will see an example of non-caseating granulomatous inflammation. Okay, see, this is a classical example is tuberculosis, caseation. Okay, caseation means what? Caseating necrosis. Caseate is cheese-like. See here, if you see histopathologically, this area, this pink in color, right? Any pink in color, if you see complete pink in color in histopathology, it is necrosis. Okay, complete pink in histopathology. If you see a large area of pink color, it is always necrosis. Okay, so when we are talking about caseating necrosis, I am not talking about the histopathology. It is cheese-like. It is a gross morphology. Gross. Caseating is gross. What is gross? No, you have to remember this. This words and all you have to remember. Gross picture means what? Gross means what? Gross feature. What is microscopic feature? What is microscopic feature? What is microscopic feature? What is microscopic feature? What is this? First, your heading of the slide. What is it? Explain the heading of the slide. Microscopic features means what? Yes, under microscope, what we are seeing. Yes, yes. Gross means what? Now tell me. Just opposite of that. What we see as such to the naked eye. If you see a specimen, it is called gross. See here, this picture you are seeing gross features. What is the meaning of that? We are seeing the specimen through naked eye without anything, microscope or using anything. We are just seeing what it is. It is called gross feature. Yes, we see yes through the naked eye. You are seeing this specimen. It is gross feature. The physical, yes, the physical appearance of anything is called gross. Okay, the physical appearance of this is a gross picture here. If you cut it, process it and see under microscope, it is microscopic feature. Okay, the caseating necrosis, what we are telling, is a gross feature. It is not the microscopic feature. This is gross. This is gross. This is gross. How we look, how the specimen looks, how the lung looks, gross. So what you are seeing here is a gross feature. How your eye looks, how your nose look, how your face. As such, what we are seeing, what it is gross, physical appearance. If you take the specimen, cut it, process it, put it under on the slide and see under a microscope, it is a microscopic feature. Do you understand this? Gross and microscopic. Do you understand this or not? Yes. So this is the gross feature and this is a microscopic feature. When we are talking about caseating necrosis, always the gross feature. Now microscopic only one necrosis. Okay, microscopic is necrosis. You cannot see a caseating necrosis there. We can find out whether it is liquefactive necrosis or coagulative necrosis to a certain extent. Okay, that to a certain extent. But after that you will see only pink color, only necrosis. See, after that you will see only necrosis, like this only. Okay, so caseating is a gross feature. But here you are seeing this area is completely, whenever you are seeing pink area, it is the necrotic area. Necrosis, okay. The caseating necrosis, but under the microscope, have particular feature. These are the features. Okay, one, it will be having macrophages. So this is a necrotic area. In the surrounding, you will have lymphocytes, macrophages. Okay, you have macrophages. You have fibrous tissue. Okay, this is a lymphocyte, macrophages, fibrous tissue, and apart from it, you will have a granuloma. What is a granuloma? It is the collection of epithelioid cells, right? So you will have a granuloma here. You have a granuloma or collection of epithelioid cell, and apart from that, the very classical feature of tuberculosis, you will see a giant cell. A giant cell is a big cell, okay, big cell, and it will be like this. This is a cell, and nucleus will be arranged like this, like a horseshoe. Have you seen a horseshoe? Horseshoe, have you seen? Have you seen a horse? Yes, horse. Horse. You know what is a horse? Horse, you know what is a horse? And you know what is a horseshoe? Yeah. Yes, it is just like this. Okay. This what is arranged here. This is a cytoplasm, and this is a nucleus. Can you see it now? So if it is a is arranged here, it will be just like this. It is called Langerhans multinucleated giant cells. See here, this is a cell, and the nucleus is arranged like this. This is called Langerhans multinucleated giant cell. See here also. Okay, in microscopic feature of the tuberculosis caseating necrosis, you will see all this. One, there is a necrosis surrounded by a collar of lymphocyte and macrophages and fibrous tissue. It will have a granuloma, so it is a granulomatous inflammation, and it will have a multinucleated giant cell. It is called Langerhans type giant cell. Okay, there are many types of giant cell, but the The cytoplasm is like this, and if it is having a horseshoe appearance of the cell, it is called Langerhans type giant cell. Okay. These are the microscopic features of the what? Yes, granulomatous inflammation, or very particularly we have to tell it is a tuberculosis. Okay, tuberculosis. Okay, we'll finish it fast. Okay, again one of the commonest infection apart from tuberculosis is actinomycosis. Okay, actinomycosis. Whenever we tell it is mycosis, what it is called? Mycology. Mycology. No, it is called fungal. Okay, it is fungal. Since you don't know the inflammation, any infection is not, you are not able to find the difficulty. If you know what is infection, what is a viral infection, what is a bacterial infection, what is a fungal infection, you will find. I am telling this bacteria, and we are talking about bacterial infection, and we are talking about actinomycosis. Okay, this is mycosis means fungal infection. Yes, but here we are talking about mycosis means it is an anaerobic bacteria. What is the connection between this? Because you are fortunately you don't know about infection now. That is only good thing. If you have known about fungal infection or bacterial infection, it will be very confusing. Now it will not be confusing at all for you. Actinomycosis, it is the anaerobic bacterial infection. If I tell this, you will believe that's all. So actinomycosis is a anaerobic bacterial infection. What is tuberculosis? Yes, it is a bacterial infection. That's all. It's a bacterial. Again, it's caused by. It is caused by causative. Yes, tuberculosis is bacterial infection caused by Mycobacterium tuberculosis. Actinomycosis is again a bacterial infection. The bacteria is little bit different than the tuberculosis. It is anaerobic. What is anaerobic? Without oxygen. Yes, it doesn't need oxygen. Okay, it doesn't need oxygen, or it needs very little oxygen. Microaerophilic. It needs very little oxygen. That's all. Okay, but tuberculosis, if you go and keep tuberculosis in the space, it will not live. But this actinomycosis can sometimes live because very little oxygen it needs. Okay, anaerobic. Okay, so it is anaerobic. It is caused by Actinomyces israeli. Okay, do you understand? Actinomycosis is infection of a bacteria called Actinomycosis israeli. Okay, it is an anaerobic bacteria, and it causes chronic suppurative disease. What do you mean by chronic suppurative disease? What do you mean by chronic? One, long term. Okay, suppurative. Suppurative means what? It produces pus cells. Pus. Whenever it is producing pus, it is called suppurative. Okay, it's a chronic pus producing disease caused by actinomycosis mycelia. Why it is important for dental students? Because it is most commonly comes in this area. What is this area called? What is this area? What bone is here inside? Is mandible. And what is this area? It is called cervical. Okay, cervicofacial area. This area you are going to deal with. Okay, that is why it is important for you. Okay, actinomycosis is a disease, a chronic suppurative disease caused by anaerobic filamentous bacteria, which is called Actinomyces israeli. Actinomyces israeli. Okay, it is a gram positive. Okay, I am not going to deal with gram positive here. Branching, again, it is a very classical feature. It will be like this, just like a fungus. That's why it's called mycosis here. Okay, branching, anaerobic or microphilic, very little oxygen or doesn't need oxygen at all. Okay, usually affect the cervicofacial area. That's why it is important for the dental students. Okay. So what is histopathology or microscopical feature? Is very classical. You will see this is a lymph node. Okay, this is a lymph node, and you see this are the bacteria, bacterial colonies, and you will see sulfur granules and inflammatory cells, chronic inflammatory cells. Okay, very easy. It is not like tuberculosis. Many features. Okay, chronic inflammation, chronic inflammatory cells. You will see sulfur granules. Okay, dark sulfur granules and branching bacteria. That's all. If you see this, it is actinomycosis. If it is tuberculosis, you have to see caseating necrosis, granuloma, Langerhans cells, and you have to see you have to see mononuclear cells and all. It is very easy. Now here you see you dark sulfur granules, you will see bacteria directly, and you will see mononuclear cell infiltrate. That's all. Okay, this is actinomycosis histopathology. Yes, you have any doubt in this? We'll see that. We'll discuss the case. A 26-year-old male complaints of cough with sputum. A classical example or classical symptom of what? Cough with sputum. No, cough with sputum is a classical of tuberculosis. Tuberculosis, okay? And it's not only tuberculosis now, and difficulty in breathing. Okay, and difficulty in breathing. On examination, loss of weight, very, very classical of tuberculosis, and decreased appetite. So X-ray is shown here. X-ray is little bit. I'll tell you what are the finding. You are seeing consolidations here. Okay. Here also you are seeing this area. Okay. This is a normal lung. The lung is here like this. Okay. The bronchus is coming. Okay. Again, this lung is here. Okay. This is the lung. And this is the heart here. Okay. So you are seeing consolidation. So what he is having some problem in breathing because of the consolidations in the lung. And you see this picture here. It's a severely immunocompromised patient. Okay. So other investigations were done. The classical clinical features of tuberculosis. These are the classical. This is what we'll give. Okay, we'll not just give the patient is having fever or joint pain, and we will not ask what is tuberculosis. We'll give the classical features. See here, low grade fever. This is not a Gong's complex. Okay, some consolidation is there. We not usually Gong complex will be here. Yes, the lower part of the upper lobe. Here there is a consolidation here. Okay, it's not Gong complex. Okay, so the classical feature is low grade fever, cough with sputum production. Not always all cough with sputum production is tuberculosis. It has to accompany with low grade fever. Even the pharyngitis will have cough with sputum. Okay, and what is this hepatitis? Hepatitis. Yes, it's sputum with blood. Sputum with blood. Okay. Sputum with blood is called hepatitis. Again, it's a classical feature of the tuberculosis. Loss of weight. Loss of weight and loss of appetite, again the classical feature of tuberculosis. This all will be present in all tuberculosis patients. Okay. So interpretation and discussion. The microscopic examination of sputum shows, see this is a gram positive acid fast bacilli. Okay, acid fast bacilli. Okay, what is acid fast? It just retains the stain, that's all. Okay, don't worry about what is the meaning now, because you will see next year in microbiology. Okay, this is a bacilli, it will be like this. It retains the acid stain. So this Mycobacterium tuberculosis, acid fast stain. Again, Jill Nelson, again it is a microbiology, we'll just discuss that. Okay, these are the things which will be present in the sputum. Okay, so the usually it involves the upper lobe, and if it is forming the upper lobe, it is called, the consolidation is formed in the upper lobe, it is called Gone focus or Gone complex. The fibrosis of Gone focus is called Ranke complex. It's all radiological. Gone focus, Gone complex, and if you see fibrosis of, this is most likely it is a Ranke complex. See, this already there is a foci of this thing, and you are seeing fibrosis here. These are all fibrosis. Okay, it is a very chronic case. It is a fibrosis called Ranke complex, and it can produce caseating or non-caseating granulomatous inflammatory reaction. What is the meaning of caseating or non-caseating and granulomatous? It produces granuloma, and the necrosis can be caseating or non-caseating. That's all. Caseating means cheese-like. Yes, cheese-like necrosis. Cheese-like. It can produce a cheese-like necrosis, or it need not produce cheese-like necrosis. And it always produces a granuloma. So that is why it's called granulomatous inflammation. Okay. So mostly in tuberculosis, it will produce, if it is producing caseating necrosis, always Mycobacterium tuberculosis. But there are few other types of tuberculosis also, where it produces a non-caseating granuloma. Okay. So this is what you have to draw. Next week I'll correct it. Okay, correct. You draw these two diagrams, and next week we'll go for a revision, and we'll correct all the four. Okay, 4 diagrams I have to correct, right? So we'll correct all the 4 next week. We'll finish the revision. After that we will correct it. Okay. Yes, just leave the system like that. The next group.
Why it's a primary, while here in the lecture, it becomes hepatitis, it's called secondary.
Just for a discussion we have given it. Usually you have to see a cavity. Yeah, there is actually, if you see clinically,